I work in this emergency room. I've been working there for the past 10 years. I love my job. I love the patients that I treat, my staff, but I hate the space where we work. It is a chaotic environment. And for those of us who have been patients in the ER, I've been a patient in the ER, you probably don't go, man, that space was designed so well, right? So how does the design of physical spaces impact hospitals through the eyes of a doctor? And how does the design of physical spaces impacts patients in their neighborhoods? There are many examples of how bad design leads to bad outcomes in the hospitals, from patient falls to medication errors, to the excessive noise, to the constant interruptions that we get. But why don't we research the spaces in which we treat our patients? Like when we develop a new medication or new surgical procedure, we do research to make sure the efficacy is there. But we don't do that with the physical spaces that we work in. So I had this question of, can we apply the rigor of clinical research to the spaces in which we work? The only problem is I had no idea how to do this. I'm not an architect. I don't know how to design a space. But fortunately, I have a lot of friends who are architects, and one of them happens to be Billy Faircloth. She's a partner at Kieran Timberlake and runs a research division there. And I said, hey, Billy, can I bring my medical students over to your space, and can we brainstorm about how we can design better spaces? So we had all these questions. Can we really design spaces that improve outcomes? Can we design spaces that improve our metrics? Redesign spaces to make the experience of patients and providers better? The problem was we didn't have good data on this. So what we did was we printed out a floor plan of the emergency department, and we started recording how people moved in time and space. We recorded where they went, what time they did that, and where it happened. And then we turned out our paper and pen prototype into this digital mapping tool that uses GIS, and this is what the data output looks like. On your left side of the screen is a data visualization of a nurse during a 12-hour shift. And what impressed us by looking at data in this quantitative way was how little time we as providers spend in the patient room and how little human-human interactions there are. In a 12-hour shift, we observed only 4% of the interactions were between a doctor and a nurse. Looking at the patient, how does the physical space of a patient's neighborhood impact their lives? Let's look through the eyes of Larique, who was tragically shot while standing on his friend's porch. Larique works with our occupational therapist at our hospital. This video's not working? Well, that's okay. At our hospital, and he also worked with our medical students in our program. And this porch is in the front of Larique's house, and it requires 2 people for him to get down to the street safely. And it's almost impossible for him to make his daily medical and physical therapy appointments on time. And in Larique's neighborhood in Philadelphia, like many other neighborhoods, there are hundreds of abandoned lots and vacant properties. And researchers have shown that the mere presence of an abandoned lot in a neighborhood negatively impacts both the mental and physical health of people in that community. There are researchers who actually greened vacant lots. They went into neighborhoods and they cleaned up the trash. They got rid of the hypodermic needles and they greened them and showed that the heart rate of people around that vacant lot that was now green actually decreased. When we invite patients to work with our team, with our medical students and our physicians, we gain deep empathy for them. We had a patient come to one of our design workshops, and he's explaining to physicians of his experience getting radiation therapy for his new cancer diagnosis and how scary it was for him. Hearing these patient narratives inspire us to rethink the hospital, rethink our role of physicians in the community, and to design spaces that heal.